Many people are wondering if kids are at higher risk of spreading COVID-19 during the holidays.
Now, there's been a lot of back and forth on this. We are joined by Dustin Monroe, the director of Mountain Star Children's Services, to tell us a little bit more about this topic. We appreciate you joining us, Dustin. Thanks so much.
No, thanks for having me. Happy to be here.
What is the research bearing out when it comes to little ones? Are they, in fact, at higher risk of spreading COVID-19?
That's a good question. A lot of people ask the same question around town. We get that question every single day. What we're finding is that children are transmitting it to adults. There's a few studies that were put out, even out here in Utah and Wisconsin, showing the smaller age children in daycares have spread it to adults. But by and large, most children are asymptomatic, and we don't know probably the true numbers of spread from children to adults, but we expect it to be fairly small numbers.
Dr. Monroe, it actually sounds like one of the bigger concerns with at least younger children are some of the mental health issues that come from being separated, segregated from classmates, from friends, and staying inside and those kinds of things.
Yeah, so every child across the spectrum is facing a world of difficulties when it comes to COVID. Even my 4-year-old, he used to call it the canola virus in the very beginning, and his whole world was thrown upside down, and he's 4. All children across all the ages are having trouble. They're missing out on sporting activities. They're missing out on school sometimes. They have to isolate because there was contact tracing, and they're missing out on lots of things that they normally would. And so kids are experiencing a lot of mental health problems. We've seen increased number of cases of suicide attempt in the hospital. We're seeing more kids expressing depression and anxiety because they're missing out on their social groups. They're not able to enjoy in the same way, even just have lunch at school in the normal way that they would, takes a heavy toll on them. And as we're coming into the holidays and trying to enjoy the time with our families, we've been asked to keep those limited to keep the spread at a minimum while we roll out the vaccine. So it's taking a heavy toll on kids. And when we've had kids in the hospital, been admitted for different reasons, and they've needed to have their parents with them. And we've tried everything we can to keep at least a couple of parents with them in the hospital. And that's really served them well. But we certainly worry about what's happening to the children in the community.
And Dustin, what should parents look out for? Because, you know, this is new terrain for them as well, and perhaps they might be missing out on maybe some of the red flags. They may not realize that their students are having a tough time with all of these new realities that they're facing. Is there something that they need to be looking out for specifically?
When it comes to the mental health game, parents need to look out for how much their children are withdrawing, even amongst their family. If they're at home and they're retiring off to their room a lot, if they're burying themselves in social media or technology more than they normally would. And we may use it as a crux to say, look, you can't go out and do activities, so here's a tablet, here's a device, and they bury themselves in it. That's going to create opportunities where they can be bullied, or they can, sort of be lost to the world. But it does create a sense of anxiety. It loses a little bit of personalization for themselves. What we need to do is find wholesome activities for them, find ways to engage them, and certainly be, something that you do for a child 0 to 3 and 3 to 7 and ages above, that's going to be very different. But it's how we communicate with the children, having open conversations and dialogue with them to really start to understand what's happening. One thing I will mention is we're seeing a lot of younger children getting hold of medications at home. Everybody's homebound, and if medications aren't locked away and stored properly, younger children might get access to them and accidentally take a medication that they shouldn't and end up in the hospital because of it. So all these safety measures are important to keep in mind as we navigate sort of this period of time during the pandemic.
Man, well, I vote that we get rid of this canola virus as soon as we possibly can. So there's so many things to think about. Dr. Dustin Monroe, Director of Mountain Star Children's Services, thanks a lot for your time this morning. Appreciate it.
Thank you.
Yeah, thank you very much.